Hi, I'm Dr. Sasser. This is Dr. Denny Carter. Thank you for attending our webinar today on the Mako Robotic-Arm Assisted technology for total knee replacement.
Hi, my name is Denny Carter. I'm an orthopedic surgeon. I went to Medical College of Georgia for my residency. I went to Louisiana State Medical Center in New Orleans. I'm certified by the American Board of Orthopedic Surgeons and a member of the American Academy of Orthopedic Surgeons.
I'm Dr. Bo Sasser. I did undergrad at Washington University in St. Louis and then attended the Medical College of Georgia for my medical school for orthopedic residency, and then did a fellowship at the University of Missouri, Kansas City in sports medicine. I'm also board certified by the American Board of Orthopedic Surgeons and have affiliations with multiple orthopedic societies.
We have offices in Brunswick as well as St. Simons, as you see on the slide. And you can see us at each of those locations with the numbers listed.
We've been designated as a Blue Distinction Center for knee and hip replacement by Blue Cross Blue Shield at Southeast Georgia Health System. We have a joint replacement center where Dr. Carter and myself focus on improving the standards for joint replacements in our area.
We're going to touch on several topics today, including understanding knee pain, various treatment options for knee pain, total knee replacement surgery, and Mako Robotic-Arm Assisted technology.
Knee pain, your joints are involved in most of the activities you do, especially those joints of the lower extremity, the hips and the knees. Walking, bending, turning requires the use of the hip and knee joints, and when these joints become diseased or injured, you can have severe pain, which will limit your ability to move and work.
Common questions. Can joint pain in my knee cause pain in another joint or my back? And why did my knee pain wake me up during the night? As far as pain in the other joints or your back, definitely if you have an arthritic knee, it may cause you to walk abnormally, and it can certainly affect either joints above or below the knee. As well as night pain. Arthritis builds up based on the amount of activity that you're doing, and when you're at rest at night trying to get comfortable, sometimes that manifests as night pain, and it can interfere with your ability to go to sleep.
Now, what happens with arthritis is you get joint degeneration. The pain from arthritis can be constant and come and go. It can occur with movement or after a period of rest. There can be what we call a Goldilocks zone, where it does very well with a little bit of activity, but too much activity causes pain, and too little activity can cause pain. It may be located in one spot or in many parts of the body.
So the slide we're looking at reveals both a normal knee and a knee with that's affected with osteoarthritis. As you can see on the left side of the slide, there's a cartilage layer that protects the knee joint. It's nice and smooth. The joint itself involves the end of two separate bones, the femur on top and the tibia below. To the right of the slide, the surface layer of cartilage has been damaged by the osteoarthritic process. This also causes osteophytes or bone spurs to occur on the edge of the joint, and oftentimes on an x-ray you'll see narrowing of the joint where the two ends of the bones touch one another.
As Dr. Carter was talking about in the last slide, this is an x-ray which shows the difference between a normal knee and an arthritic knee. And of course, in this x-ray with the normal knee, there's a nice joint space between the two bones, the femur and the tibia, whereas with the arthritic knee, there is collapse of the bone, there's deformity of the bone, and large spurs or osteophytes, which basically is secondary to the arthritis.
So when we discuss arthritis, arthritis basically means inflammation of the joint. It's the nation's most common cause of disability. It affects 54.4 million American adults. More than 1 in 4 are affected. It's a leading cause of work disability in the United States.
Now, there are a few types of arthritis. The most common type, what we call the wear and tear type arthritis, is osteoarthritis, which we've discussed. There's also rheumatoid arthritis and post-traumatic arthritis. Rheumatoid is secondary to an autoimmune type disease which can destroy the bone itself and the capsule around it, or post-traumatic arthritis, which some patients have secondary to previous accidents.
Osteoarthritis is one of the most common reasons that we treat patients. It's sometimes called degenerative arthritis because it's a wearing out condition involving the breakdown of cartilage within the joints. When the cartilage wears away, the bones may rub against one another, causing pain and stiffness. It can affect not only the knee but other joints throughout the body. 27 million Americans suffer from osteoarthritis.
And then, like I said, there's rheumatoid arthritis, which is an autoimmune disease in which the body's immune response affects the lining of the joints, called the synovial membrane. This is kind of like the inner capsule of the knee. This causes chronic inflammation and leads to breakdown of the joint. About 1.5 million people in the U.S. have rheumatoid arthritis.
The other common type of arthritis is post-traumatic arthritis, and this is a type of injury to the joint that occurs after any type of injury, fractures, dislocations. If the joint is damaged enough, it'll cause breakdown of the cartilage and can lead to worsening degenerative condition because the cartilage didn't heal properly following the original injury.
Now, there are treatment options. Of course, Dr. Carter and myself always like to focus on conservative care. There's physical therapy, diet and exercise, using walking aids, heat or cold, medications such as NSAIDs or anti-inflammatories. Sometimes we use cortisone injections or viscosupplementation called joint fluid therapy. And then finally, joint replacement surgery.
One of the main treatment recommendations for patients who are overweight is weight loss. If you're carrying more weight than you would like to, it can affect the joint surface. Approximately 4 to 1 is the amount of pressure on the joint surface for the amount of pounds overweight. So if you're able to lose weight, just remember that losing 1 pound is about 4 pounds of pressure off the joint, which can lead to an improvement in symptoms in many cases.
Exercise is also important. Regular exercise may help arthritis. This doesn't have to be higher impact type things. You can actually try lower impact exercises, biking, elliptical trainer, or just walking. But the motion itself can improve the symptoms and also increases the strength of the muscles around the joint, which can aid in preventing the pain with arthritis.
Of course, sometimes conservative treatment does not work, and joint replacement may be indicated for certain diseases or certain degrees of osteoarthritis. According to the Agency for Healthcare Quality and Research, more than 600,000 knee replacements are performed each year. Approximately 450 of those performed here at Southeast Georgia Health System.
The Mako total knee replacement is part of the Mako Robotic-Arm Assisted technology that we have discussed before for the partial knee replacement, the hip replacement, and now the knee replacement. It's a procedure designed to relieve the pain caused by joint degeneration secondary to arthritis in the knee. The Mako Robotic-Arm Assisted technology provides the surgeons with a personalized surgical plan based on the patient's 3D model of their knee. It allows the surgeons to remove only the diseased bone, preserving healthy bone and soft tissue, and assist your surgeon in positioning the implant based on the anatomy.
Okay, this is a photograph of myself performing Mako Robotic-Assisted total knee replacement. As you can see on the screen, in the background is the Mako robot. I'm holding the patient's leg. There is 2 devices attached to the patient's limb. Both of these are tracking devices that actually give the exact position of the knee in reference to the body, so that the robot knows exactly where everything is in space. And it's part of the advanced technology that we use for our total knee replacements.
So how it works, first off, you have a personalized plan. Each patient receives a CT scan of the joint, and that generates a 3D model of their unique anatomy. This virtual model is loaded into the Mako software, and it is used to create the personalized preoperative plan. So when we even walk into the OR beforehand, we know the size of the implant and pretty much the position of the implant, which we can then template or position to that person's anatomy more accurately, as Dr. Carter will discuss.
So when we're in the operating room, we'll see a computer screen as we're doing the procedure that shows a model of the knee, basically the anatomy of the knee as the implant is positioned onto the knee. We use it to assist with the surgery and essentially confirm our preoperative plan. We're able to make adjustments based on what we see intraoperatively, and then once we confirm that, the operation becomes a matter of executing the plan that we have already sort of gone through prior to the procedure. Intraoperatively, we see this screen as we're doing the operation. We make slight adjustments, and then once we've confirmed everything, we proceed with the knee replacement itself.
So then after surgery, this is a post-operative x-ray that was taken of a patient that had a Mako total knee replacement. And as you can see with the x-ray, the metal implants are the white areas where we have replaced the knee joint, and now the knee is stable and straight. We will closely monitor patients' condition and get them in rehab for their therapy to regain their motion and their function.
So the Mako robotic arm technology, it does not perform the surgery, it does not make decisions on its own, and it does not move in any way without the surgeon doing it. This technology is a very advanced tool that we use for more precision and accuracy in performing the knee replacement.
Now, as stated, after the total knee replacement, we get the patients in physical therapy as soon as within hours after the surgery itself to begin range of motion, ambulation, and to try to get their function back as soon as possible. This allows them to go back to realistic physical activity such as walking, swimming, golfing, driving, light hiking, biking, dancing, and other lower impact type sports.
So the question of, do I need surgery? Are you less active because of the knee pain? Does the knee pain affect your ability to walk upstairs? Is it difficult for you to sleep due to the knee pain? There's many other concerns. Is your knee giving out, perhaps predisposing you to falls? It becomes a level of how severe the knee pain itself affects your daily life, as well as other considerations in determining whether you actually need surgery. This is a discussion that you'll need to make between yourself and your physicians, not only your surgeon, but other physicians involved in your care.
So thank you for attending the webinar. I hope that you've gleaned some information about this great technology that Dr. Carter and myself are able to utilize at Southeast Georgia Health System. You can please submit any questions via the chat bar. All the questions will be answered individually through the email. If you have any knee pain, you can contact our office directly at 912-466-7340. Make an appointment with Dr. Carter and myself, and we'd love to talk to you about it. Thank you.
Thank you very much.